great congressman we have back there representing this part of America, and so I guess I had to take my time behind the re-election and taking back the House and the transition team. Now, here it is only March, and he's already here to help celebrate what we've done. So thank you very much for being here.
Well, Bob, I want to thank you. I want to thank you and Sue and Terry and Jim and everybody who's been involved in this project. I also want to thank you for your good common sense in going ahead and opening the doors before the ribbon cutting. 600 plus patients, right? I'm a little cranky at me. It's like, you know, if you go to a senior center to speak, you always want to wait until after lunch is served. You don't want to stand between seniors' lunch. But I'm delighted to be here. Like, this is incredibly important to the community. And I just want to thank you and your wife and your other partners who are involved in this for investing in this community. When you talk about how do you create jobs, the government didn't create this.
No.
They did. They're taking the risk.
Yes.
And that's how we create jobs, is in the private sector. And that's part of why I'm here today, to say thank you for taking the risk. You're in a very regulated business. You have been a great mentor of mine on how some of those regulations work against you, and occasionally for you, but not very often. And the same in the delivery of health care. You know, there are a few things more important in a rural community, or any community, but especially in a rural community, than maintaining access to affordable health care. And certainly this clinic does this, the addition of the pharmacy does this, and the partnership of the two makes it both convenient and helpful for people to get their health care. It allows communities to move forward, and without it, people go, well, do I really want to, you know, is that where I want to take my business? So you're a core part of moving health care forward and the economy of this community forward. So I thank you for your investment here, and for the access to quality health care here. It's important, and Tara and I were talking that here, what did you tell me, over 600 so far? The cases and or patients, and that's a lot. That's a lot. In 5 months, hit 600. You know, and so it tells you there's a need that can be met and is being met now, thanks to what you all have done. So I'm not really from the government. I'm from Hood River. I am here to help. I was in small business for 22 years, and so I just want to say thanks for what you're doing, and congratulations on a beautiful facility.
Just got to figure out how we can afford to pay for this health care.
Yeah, that is something we're working on, obviously, with the new federal law that was passed in the last Congress. We're now beginning to see the rollout and some of the effects, and already Health and Human Services Secretary Sebelius has issued 1,000 waivers on the law. 1,000 waivers. Businesses, big labor unions, even the whole state of Maine. I mean, it's just, we're now finding out what some of us were concerned about, is it wasn't well thought through. It was rammed through, it wasn't thought through. And now we're going to have to come back and try and figure out that which is going to stay, how you fix it. And so it's there's a lot on the line on our health care going forward. States, we've had hearings, state governors have come forward to express deep concern about the new mandates on the states and what that'll mean to their programs and costs that they can't afford. But anyway, we can save that for another day. But just know, being on the Energy and Commerce Committee, we have jurisdiction over a lot of these issues, and so we've already had hearings. We'll continue to have hearings and work on legislation to make changes. Yeah.
Yeah, Greg.